This conference will now be recorded.
And any questions from you guys? It's a quiet bunch.
I'm curious. I'll ask a question. I'm just kind of curious about all of the things that we're having to do, and if they're really helping. You know, let's say we have gloves and bandanas, and we're washing our hands like crazy and washing clothes and 6 feet apart. So is that really helping?
Leslie, do you want to start? Dr. Black?
Yeah, sure. You're right, Cindy. There's a lot of different theories on whether the social distancing and personal protective equipment is doing its job. I'm here in Southern California, so we have. I'm in San Diego specifically, so I think in California we have the third largest number of cases right now, and we have as of today, about a little over 2,400 confirmed cases. We have about 96 deaths, I think. And unfortunately for us, we actually don't have a lot of access to testing, believe it or not. So that's been kind of an issue. So we don't really know exactly how many cases that we have. So for us, we are required to wear a mask, mainly a mask, whenever we're out in public, even walking on the street, obviously going into the grocery stores, anywhere that we're in a public place. And some people are adhering to that and some people are not. I would say from what I've seen, it's about 50-50. And it is really hard to tell, if this is actually doing its job or not, because what we're finding is a lot of the people that are walking around, as you might have heard, could be asymptomatic. So it is really difficult for us to actually put a number on it as to if all of the social distancing and the masks and such are doing their job, especially where I am right now. And I'm sure Dr. Karlfeldt, you could speak a little bit more about Idaho.
Well, yeah, I mean, here in Idaho, it was at a radio call-in show. There were some doctors who were calling in, and they were saying that there were in all of ICU in all of Idaho, there were 44 people in ICU, and that's 44 people of for all different reasons. So Corona is we're not impacted by it that much here. So to have such a stringent restriction here in Idaho with as cases as we have, I don't see the reason for it. But obviously, I'm not the governor. And in regards to mask, is that when you're outside in the sunshine and breathing oxygen, the oxygen helps to support the health of your lungs. So, and also the sunshine helps them to kill off pathogens. So you use, sunshine, you can put things out. That was kind of an old thing that you used to do, if you want to kill off pathogens or kind of sterilize a blanket or your clothes, then you would hang it outside. So that was one of the reasons also when you have the clothesline outside and you hung them, and actually the sunshine would then sterilize the clothes. So for me to walk around with a mask while you're outside doesn't make any sense, because all you're going to do is then to reduce the benefits of your immune system at that time.
Mm-hmm.
In regards to, yeah, mm-hmm. In regards to inside, so at that time you are mostly, well, you're protecting yourself somewhat, and you're protecting others somewhat. Yeah, so and the thing with 6 feet, it used to be with Ebola, it used to be 3 feet. There was a 3-foot rule, so it seems to be kind of an arbitrary number. I don't know how far a sneeze, goes, but I'm sure it's further than 3 to 6 feet. So it's kind of an arbitrary number, right now. But and then with gloves and how you're handling things. I mean, you're protecting your hands somewhat in that way, but the question is always, you know, what's your risk of exposure, and you know, what's the benefit of it? So, did that answer your question, Cindy?
Yes, it did. I guess I keep thinking, oh, so all of this is, we've been going through this now for 6 weeks or so. And when it's all said and done and we all flood outside again, what's going to stop it from actually spiking back up again?
Yeah. And that becomes a big issue, is that you really, because we have been quarantined, we really don't know what will happen when we're not in quarantine. So have we developed herd immunity here or not? Well, we had Tommy Alquist, you know, he did his sampling of things like 3,000 people that he's tested so far. And it was a very, very small percentage of people that had that tested positive. So, which means that, you know, the question is, where's our herd immunity? And also, in addition to that, what does it mean if we have antibodies? But then if we question that, then also what does it mean as an impact if we get a vaccine? You know, often does attempt to develop antibodies. So does that protect us or not protect us? Or, you know, do the antibodies, you know, that we have, if IgG is showing high, you know, are we protected or not protected? Any other questions, all you guys out there? And if you,
Can I just say something real quick? Lori, can you mute yourself?
Let's see.
Oh, there you go. Yes. Good. And any other questions? I'm sure there's other questions. Hello there, Tara.
Hi. I have a question about aerosols in the dental office.
Yeah.
We put out a lot of aerosol when we're working, and I'm just thinking of a way to protect the patients. We can wear the masks and all of that, but the patients are the ones that really, especially since they're saying it can be in the air for 3 hours. I have heard you can have the patient pre-rinse with the hydrogen peroxide. I don't remember what the percentage was, but I was wondering if you had any thoughts on that.
Yeah, hydrogen peroxide, and what's interesting is that the coronavirus, it actually matures in the parotid glands, so before it goes down into the respiratory. So if you are in a situation where you think that there's exposure, you can then gargle with hydrogen peroxide, or maybe use some colloidal silver, gargle with that. You also have kind of methylene blue that we have here as a gargle. You can do that. So there are different ways that you can then help to clean out the areas where the virus have to mature before it goes down into the respiratory. And any thoughts on this, Dr. Black?
Tara, do you guys have specific HEPA filters in the rooms that you perform the procedures?
No, not at this time. This is all new.
Okay, I know some dental offices have installed HEPA filters in the rooms in which they are having to perform procedures. And a lot of our dental offices here are at this time not performing procedures, just because we've had an influx of cases, of course. But that is one recommendation that I know after I was speaking with a dentist who practices in Italy. And they did install the HEPA filters, but ultimately decided to close down the practice just because, all of the cases that started to erupt in Italy. So that was one thing that one piece of advice he passed along to me.
And I know also Dr. Montgomery, she uses different techniques. Dr. Veronica Montgomery uses different techniques with ozone to really help to kind of clear out any possible infection in any way.
Is that in the room? I mean, is that ozone in?
So I think it has to do more kind of rinsing the individual with ozonated water. So
Okay.
it's kind of, so it's not in the room directly, but yeah, you're right. You have it hanging out in the room for about 3 hours. And that's the issue, you know, when you go to the grocery store or go to wherever it is that you're going, it's going to be, you can't really do contact tracing that they're trying to do to figure out, you know, who's been exposed to what, because if you have something that's out in the air, you know, how do you do contact tracing on that? You really can't. So yeah, I mean, probably I would use things like I mean, you have the aerosol, but even eucalyptus oil, or do a diffuser of that, because that kills about 99% of it, you know, of a lot of different pathogens. And then sometimes you have these different filters or air purifiers that uses UV, you know, so you can kind of allow kind of filter the air than using UV or a HEPA filter that, you know, Dr. Black is talking about.
Even opening the windows probably in the office, would that help to?
Opening the windows and sunshine. I mean, sunshine is a fantastic killer. So yeah, if you can have good circulation, obviously that will minimize, and that will kind of allow things to move out, so it's not stagnant in the air.
Tara, that's what I'm doing right now in our office. We just recently reopened our clinic last week, and we have a room that's specifically used for IVs and sometimes procedures. And so we have opened that window, and we're allowing one person at a time in that room. And then there is a good amount of sunshine that comes into that room as well. So we're pretty much just leaving that open all day long.
Yeah, thanks.
You're very welcome. And who's up next with questions?
I have a question. My question is, excuse me, if you're asymptomatic, how do you end up spreading it if you don't cough or sneeze or anything else?
Do you want to answer that, Dr. Black?
Well, what they're finding with asymptomatic patients is kind of interesting, because some of the research that they're doing is they're finding that the patient can be contagious for quite a while prior to actually, let's say, testing positive. Okay, so you're asymptomatic and you decide to get tested just because you'd like to know, right? And you test positive, and you can still be contagious after. So they're not, it's still kind of unsure as to whether it's the patient touching things that which another person then touches and then puts on their face, or their hands go into their mouth, whether it can be through the air if you're having a conversation. Let's say you're not doing the social distancing, or you know, you're in close proximity of someone who has some of these other risk factors. So some comorbidities, or those with weakened immune system, and then can pass it on, in which they will become symptomatic. So I think a lot of it is still trying to be understood in terms of asymptomatic patients and what that means. And I think that's where a lot of the fear is originating around this is, you know, if you are asymptomatic and you are a carrier, how are we spreading this? How exactly are we spreading this? And I think that there are a lot of the researchers are still trying to figure that out. How about you, Dr. Karlfeldt?
Yeah, and that's a scary thing. I mean that's probably the scariest thing, because you don't know if you are spreading, or you don't know if you are infected. So you have then that uncertainty as to what your impact is on the people around you. So it is a little bit hard. I mean, I come from the viewpoint, and a lot of people don't agree with me, and I'm okay with that. I come from the viewpoint of herd immunity, meaning that the best that we can do is to have controlled exposure, where we are then allowing our immune system them be exposed to the real thing, and hopefully then develop the antibodies that we need to in order to be able to kind of keep this pathogen as check. I feel that we are as a species, as a human species, you know, we have evolved being exposed to all kinds of different pathogens, and we haven't really understood all these different pathogens. We haven't figured out whether we spread them when we're asymptomatic or not. But somehow we, you know, most of us survive. You know, actually a high percentage of us survive. I mean, we have different pandemics that come through, but they spike and then they disappear. Whether this one is in the same, I mean, behaves in the similar fashion, we assume that it behaves very similar to SARS or MERS, you know, which is a Middle Eastern respiratory syndrome. But we are controlling it in a different fashion now than what we did with SARS or with MERS. So we're kind of in a new territory because we've been trying to kind of flatten the curve instead of allowing to have a spike and then allowing to dip. I know in Sweden, for instance, they behave differently than a lot of other countries, where they allowed then it to spike, and so they had a higher number of I wouldn't say higher number, but that it rose quicker, and then now we're on the downturn. It seems like I spoke to my mother this weekend, who lives in Sweden, and their epidemiologist keep them. I guess I'll call her number 3, whoever that is. But what she was seeing, or what they were seeing, is that I think they've had 1,500 total deaths in all of Sweden so far, and a third of them are elderly, and most of them actually have been in homes for elderly, so where they're in continual hospital care, but they still got the coronavirus and passed away from it. But they have the same issue that we have here, is that we're trying to blame a lot on the coronavirus when we really don't know whether it's a coronavirus or not. So I'm a little back and forth as to, you know, the precautions, and then also what it does to us immune system wise, you know, going through these precautions. Did that answer anything, Lori? I know it was a little bit of a
Yeah, that was very helpful. Thank you so much.
Oh, you're very welcome. Thanks. Who's up next?
Hello, this is Karen. Do you have any information on the vaccines that are coming out?
Yes, I do. So the vaccine, they're actually skipping animal testing on it, which is obviously very scary, especially since the prior history with the coronavirus vaccines that they've tried to create in the past. I mean, there's a reason why we don't have a SARS vaccine. There's a reason we don't have a MERS vaccine, because of the impact that it had on the animals that it tested it on. And that's where what's called pathogenic priming comes in. And what that means is that you actually introducing, giving a person a vaccine, and then they're exposed to the pathogen later on, let's say 2 years after the vaccine, they are more likely to develop autoimmune conditions or death. So the vaccine is not, they're trying to fast track this vaccine, which is, I think, it's a huge mistake. I think we should really communicate to our legislators that we want to make sure that somebody, can everyone mute their mics, make sure they mute their mics. Everyone make sure that you mute your mic.
because I think that started when I went on.
So yeah, so I think we should really reach out to our legislators and ask them to make sure that they stop phase 2 testing and that they do small sample animal testing first, and that it's a big deal for this vaccine to come out into the market. I mean, there's no other drug that they kind of move through this quickly without proper scientific testing. And so I'm really concerned about this vaccine that's coming out and the impact that it has. And it may not be that you have an impact immediately when you get the vaccine, but it becomes kind of like a ticking bomb. And so I'd like you to look up, pathogenic priming in regards to this vaccine. And actually, the gentleman that I spoke to, and that interview will air this Sunday at 5 o'clock here locally. Dr. James Leon Weiler, he spoke a lot about that, so that'd be really fascinating for you to listen to. Any other words, Dr. Black?
I agree, and I'm really excited to listen to that interview as well. And I think, especially here in California, we've had a lot of people fearful of the political agenda behind the vaccine and government mandating. I know we've had a lot of conversations about that recently, so a lot of people are very concerned here when it comes to that, and to see whether the government makes this something that everyone is going to have. So we'll wait and see.
So is that what they're talking about, is mandating that everybody have it?
It's one of the conversations that's been brought up, and maybe specifically here in California. I don't know about Idaho, but it is one of the conversations, and a big concern for a lot of people here, that there's been talks of that. Now, I can't tell you for sure how relevant that is. It's just been different individuals speaking about that and had questions in regards to that. So we don't know a whole lot at this point as to whether the government is this going to be something that they recommend or deem mandatory.
And the thing with vaccines is something that can be done state by state. And I know Governor Little, when he was giving his address today, it seemed like he was really feeling that we can't go back to normal without people getting the vaccine. So I'm not sure what that means yet.
Very similar to what's happening here in California as well.
Yeah.
Great. Thank you very much. I appreciate it.
You're very welcome. Very welcome. Who's up next?
This is Lori. I have another question. What is your opinion or take on this treating cases with this whatever they call it, stuff when people get real sick?
The hydrochloroquine, is that what you're talking about?
Yeah. Yes, that's it.
Yeah. Mm-hmm. I think that is a, go ahead.
Do you think that's a good thing?
I actually think that is it's a great option. I think doing that in combination with zinc, I think that is an excellent option. And I mean, it has now become, it's something that we're using in Europe, and has now become, I believe it's FDA approved now. So it is allowed to be used. When I was talking to Dr. Weiler earlier today, and you'll hear it on the show on Sunday, he was making some comments in regards to that, how they were trying to kind of use research or change research in a way against it. And I think the reason for that is that there's probably some political agenda in regards to that. But it seems like people that are having difficulties, and then at an appropriate amount, and I think it's like 200 milligrams, twice a day, along with like 220 milligrams of zinc. They really seem to do well with it. I don't have a personal experience. It's just what I heard from other doctors.
Okay, thank you. I was just, they only seem to be doing it when the cases are severe. I mean, I guess that's the protocol.
Yes, I mean, for me, the key is to it's not really, the virus is already here, so we're not going to be able to get rid of the virus. You know, the genie's already out of the box. You know, so anytime the virus is here, it's here. So the key always becomes to then support the immune system so that you can keep the viral load down. So then you have tools like, you know, vitamin C, vitamin D, vitamin A, you know, that stimulates the interferon production within our bodies that helps to then kill off viruses. So if we can keep the viral load down, even though we may have it, if we can keep it down so it doesn't, so the immune system doesn't go berserk, then I think we're fine. So it's just going back to healthy basics and supporting the immune system. And we offer therapies here as well, where we do intravenous light therapy, you know, where you kind of prepare the body initially and tag the pathogens with, we have vitamin B2 or methylene blue is another tagger, and it just kind of tags the pathogens and you kill them off with different lights. And that's exactly how they kill off viruses and pathogens and bloods that's being donated to make sure there's no hepatitis B or HIV or whatever. So we do that directly intravenously, and that can be a good thing to do just to kind of keep the viral load down so that the immune system doesn't overreact. Any other thoughts?
Is that done as a preventative, or you do it when you get the virus?
I would do it as a preventative, yeah, because you, if you're then exposed to the virus, then you've kept the other viral loads low so that the immune system doesn't overreact.
Oh, okay. So is that a costly thing, or?
It depends on how you define costly.
Well, I don't know. Thousands of dollars or hundreds of dollars?
No, it's not thousands of dollars. It's I think the IV in itself, the laser, intravenous laser therapy, which treats your blood about 60, your whole blood volume about 60 times. That's about $200, and then the vitamin B2 prior to, I think that's like $100. So it's like $300 to do that. And if you do that, you know, once a month or something like that, now people are scared.
Okay, great. But you need to do it more than once.
Well, it's one of those things that, you know, you don't know. You know, one is better than none, and more is better than one. But I don't know exactly, you know, because it helps to kill off the load. But then, what if you're exposed and later on that month? You know, so that way you're continually just kind of cleaning the blood and making sure that you reduce the risk that you have.
Okay. So there's no exact science. It's just a matter of what you can afford, I guess.
Yeah, I mean, the process is very exact science, but for what an individual's need is, it's hard to determine.
Right, I understand. Okay. Even if they're in relatively good health, you can still.
Yeah, so I mean,
exactly.
If you're in good health, then do it once, and then maybe, you know, take some vitamin D, zinc, vitamin A, maybe gargle a little bit of silver biotic or, you know, colloidal silver, you know, on a daily basis. That should help tremendously.
Okay, great. Thank you.
Very welcome. And anything you want to add, Dr. Black?
Lori, real quick, going back to your question about why they're using that particular medication for patients that are considered more severe. They are using it for moderate cases as well as severe cases. And really, the reason for that is that medication actually helps zinc come into the cell, you know, come into the body. It's called a zinc ionophore, which means that it's a gate. It opens the gate for zinc to come in. And the interesting thing about zinc intracellularly is that the coronavirus is a very interesting and intricate virus in that it acts very similar to our RNA. So our DNA makes our RNA. And what happens is when we have enough zinc intracellularly, it actually will inhibit what's called replicase. And replicase is what allows that coronavirus to keep replicating in our body. And that is what causes a lot of times the patients to become severely ill, is because this virus is allowed to continue to replicate. So those that have a lower amount of intracellular zinc in some ways can be more predisposed to this virus. So they use this medication essentially to get more zinc into the cells. I hope that answers your question.
And I'd like to add actually one.
Yeah, that's great to know that. So I have a husband that is, he came down with a blood cancer. He's 81, and he came down with a blood cancer that supposedly could be related to the use of Roundup. He was using Roundup on our acreage a number of years ago. We don't have it anymore, and he's not using it. But anyway, we found out that apparently the particular kind of cancer, blood cancer that he has, could be associated with that. So I am considering, and it's not a cancer that can be cured, but he is in remission right now. He's had one round or one series of chemo, and that did put it in remission. And he has to follow up every 3 or 4 months with blood work to see if he's still in remission. But I'm actually more concerned about him than I am myself. And so I think he really needs to get in there and get some of this IV done.
Yeah, it would help him tremendously. And in fact, in addition to these photosensitizer tagging the different pathogens like virus, Lyme pathogens, bacteria, whatever it may be, it also tags cancer cells, which is fascinating. So it actually attaches into these cancer cells. So when the blood passes by the intravenous light, the optic cable, the cancer cells get blasted as well, in addition to the pathogens, which is really, it's an additional benefit for him.
Oh, great. So maybe I should get him in before myself. So thank you for that.
Yeah, you're very welcome. Absolutely. Great. Sarah?
I have a question. Can you hear me?
Yes.
Okay.
Yes, we hear you.
Okay. Dr. Karlfeldt, this is Sarah True.
Oh, hello there, Sarah.
Hi. So I just have a question. So I know that if I get the coronavirus, I cannot take the hydrochloroquine because of my prolonged QT, my heart arrhythmia. So if I end up getting it, are you accepting patients that are that sick to get like IV therapy or vitamin C therapy?
We actually can't, because
Okay.
what happens then is that then we have to shut everything down for a while, which kind of sucks. So
Okay.
that's why I'm so pushing prevention and really making sure that you take care of yourself and you benefit from these different IVs ahead of time, because if you get it, and I can help you over the phone, and I've done that with many patients that were really in dire straits, and we did telemedicine and we're able to turn them around actually quite quickly. So but it's nice to, and that's why I'm coming in with the glutathione and the Myers full extra vitamin C, or the blood purification type of IVs. Those are, it's so good to do that ahead of time, so you keep your immune system strong and you keep the viral load low, because as I said, when the viral load is low, your immune system is less likely to hyperreact. And it's not really the virus in itself that kills people, it's the immune system's reaction to it.
Okay. So if I end up getting it really bad and I have to go into the hospital, do you know if they provide vitamin C IVs if I request it?
They probably will not there, no.
Okay.
And if you're in very specific clinics in New York, then yes, or hospitals in New York, then yes. But I would wish that they did, because the protocols that they used in China and also in some hospitals in New York were very effective. You know, where they did a continuous drip of vitamin C, and what that did is that it controlled then the immune system's hyperreaction and reduced the level of what's called reactive oxygen species, or that keeps feeding that inflammation. And it's that inflammation, that cytokine storm, that really moves a person into a direction we don't want. So, and that was the beauty with the continuous drip of vitamin C.
Okay. All right. I came in and did Myers and a glutathione IV, and this was last week, I think. And I don't know is it Sally or Sandy?
It's Sally.
Sally. I don't know if she told you, but I was really sensitive to it. I was up all night. I was having some reactions. After a couple days, I felt so good though. I felt really good. I was more concerned about my heart arrhythmia than anything. But so I did that one time, and I can't afford to come in every week to do the Myers and the glutathione. So how much is, like, if I come in and do just like a vitamin C IV every week, how much is that?
So the just the vitamin C in itself is I can't remember.
Okay.
Probably 100. I don't know.
That's okay.
It's mid 100 something.
Okay, but that would be a good preventative as well, right? To just do that every week?
Yeah,
okay.
Absolutely. Yeah.
All right, that answers all my questions. Thank you, guys.
You're very welcome, Sarah. Who's up next? Robin, I know you have a question in you. and any other questions? I know
well, I can ask another one.
Yeah, please go for it.
Okay.
I want to make sure that all the questions are answered, because there's so much concerns that are going on.
Well, I will wait then.
Please, Sarah. Go ahead, Sarah. I can't hear you.
Go ahead. Oh, okay. Sorry. I've just been doing a bunch of research on the most natural way to take care of this if somebody, gets it in our family. So, I saw some deep breathing exercises. Do you know much about that, or would you suggest a certain type?
So the issue with the coronavirus is that deep breathe, and this is one of the issues. So they had a difficult time sometimes with ventilators, just because if it gets really bad, I mean, obviously if it gets really bad, you need to be at the hospital. So up to that point, deep breathing exercises are great, because then you are helping to clean out, a lot of the buildup of carbon dioxide, and you kind of flood the area with oxygen to allow it then to heal faster. So that is a really good thing, and you help to kind of move mucus and you help to kind of facilitate the removal of that out of the lungs. So yeah, deep breathing exercises are really good, and you can do and steam inhalation, where you put a little in a pot of water that you boil and put a little bit of eucalyptus oil or some other essential oil, and you breathe that in just to help to kind of get it into the lungs, loosen up the mucus and clear that out, and hack it out. It's a really good, really good therapy.
Okay, thank you.
I have another question about the ventilator. This is Lori. I've been hearing or reading about the fact that a lot of people, when they do go on the ventilators and when they get to that point, that they don't come out of them. Is there a reason why that is? Is once they get on the ventilator, then they don't recover? Is it because of their underlying conditions, or is it because of the ventilators?
Go ahead,
There's some
Dr. Black.
questions.
Sure. Well, Lori, I think there could be a combination of things. What they've seen, a lot of the cases that when they get to the point of being on a ventilator, most of these patients do have some sort of comorbidity or underlying health condition. And there's several different things that can occur when the patient is on a ventilator, when they're at that stage, because as you know, being intubated and being on a ventilator, the progression of symptoms have to happen very, very, very quickly. And I know Dr. Karlfeldt was mentioning earlier about the cytokine storm. There can be things, for instance, with patients with cardiovascular issues where you see a big spike in blood pressure, a drop in potassium, and that puts the patient out of balance with their electrolytes. So there's several different things that can occur. And I think because they're already at that stage, the ventilator doesn't seem to be doing a whole lot of good at that point.
I see. Okay. So I have heard a lot
So
about that.
Yeah.
But it's probably because they're already at that point.
Right.
Yeah, what happens with the ventilator? So you have the lungs. You have like a membrane around the lungs, and through that membrane, or the alveolar space, so to say, there's a little bit of a membrane, and through that membrane, you're diffusing a gas. The issue is that if that membrane then becomes inflamed, then you're not able to diffuse gas through it. So then with a ventilator, you're then trying to push oxygen into the lungs, but the oxygen is not able to disperse into the bloodstream from the lungs. So all you're doing is creating pressure within the lungs, and actually can then injure the lungs if you're at that state. So that becomes the issue in regard to that.
Okay, thank you.
You're welcome. I'm actually gonna answer Robin's question because she can't unmute herself. So she's wondering about the top supplements with amounts, and vitamin D amounts especially, and do we need to take vitamin A with it or any other vitamin? How much zinc, and what about glutathione? So I'm usually I like to hit it hard with vitamin D when you need to. So I have like a acute viral protocol that I run where you hit it with like 200,000 IU vitamin D for a few days, and then you can go down to like 25,000, and then once you're out of the woods, and go down to 10 or 5, maybe 5 for maintenance. The vitamin A, I like to hit it hard as well, around 200,000 as well. And zinc, I mean, like when they're doing these studies with the hydroxychloroquine, they were using up to like almost 450 milligrams of zinc per day. So obviously you don't always need that much, but if you do like 150, you can do easily. Glutathione, I'll probably do, if you can get at least 1,000 milligrams of that. If you want to combine that with NAC, which is a kind of precursor that can easily get converted to glutathione, like a 2,000 milligrams per day, tend to be good. And these are just kind of for a normal adult. So obviously you need to adjust based upon who you are, size-wise, and also where you're at condition-wise. Do you have any other favorite supplements, Dr. Black, that you like?
I actually use all of the same ones that you just mentioned. I do actually like to use a nebulizer of the combination of the NAC and glutathione. I have found that works very well for those that do have any type of lung issues, asthma, tendencies to have a lot of upper respiratory infections, and even as a preventative measure, if you don't have any of those things, getting the NAC and glutathione into the lungs, I have found is very, very helpful. And I like your protocols, kind of the loading protocols for the vitamin D and the vitamin A. Quercetin would be another one I use about 500 milligrams twice a day of quercetin for prevention and helping with with inflammation. I'm reading your comment here, Robin. Can you repeat the glutathione? Were you speaking about the dosing or for the nebulizer? Okay, so for the dosing, Dr. Karlfeldt, what dosing were you using of the glutathione?
Yeah, I think just like a 1,000 mg a day, and especially if you combine it with NAC, I think that makes it very, very powerful. And you can add a little bit of selenium to that to help the process as well. I think selenium, you want to make sure that you get more of the kind of organic kind, like a selenium methionate, instead of some of the kind of harder to absorb salts of selenium. And that one, selenium, but 200 to 400 micrograms a day in addition to, can be helpful.
Where do you get the glutathione? You get the glutathione in a supplement tablet?
So the best way to do glutathione is either kind of an activated form, or what I like the most is if it's in a liposomal form. Just because it's so hard to it's hard to get it into the cell, and because it's such a complex molecule, so it almost has to deconstruct itself in order to be able to get into the cell, and then the body has to reconstruct it again. So if you can do it in a liposomal form, it has an easier time to penetrate the cell wall membrane.
Okay, thank you.
You're welcome.
Do you have the liposomal glutathione at your office?
We do, yes. Yes.
Okay. So, Dr. Black, so if we wanted to do the NAC and the glutathione through a nebulizer, would we have to get a nebulizer for my primary care doctor? Would we have to request one that way?
You know, I've had some patients have their primary care write them a script for the nebulizer. I've had other patients too order them off of Amazon.
Okay.
Yeah, some people have been able to get them off of Amazon. I haven't checked recently, but I know at the start of this outbreak, it was really hard to find any nebulizers on Amazon. So they were asking their primary care doctors to write them a script for it, and then they were sent a nebulizer to their home.
Okay, and would that be preventative?
It would, yes. I'll just give you an example. I use it for myself because I'm back working in the clinic and seeing patients and doing IVs. And so I typically will use my nebulizer a couple times a week, and I will use a combination of, it is a compounded glutathione from our compounding pharmacy, as well as a compounded form of NAC. Both of those have been compounded specifically for nebulized use.
Okay, so do you just mix that in with like a couple drops of each in water? How do you do that?
Yeah, so we use saline or distilled water. So I will do about 1 milliliter of the glutathione and 1 milliliter of the NAC. I mean, you could do a couple milliliters of each if you wanted to, and then it would be kind of a 1-to-1 ratio. So if you're going to use 1 milliliter of glutathione, 1 milliliter of NAC, you'd want to use 2 milliliters of normal saline or distilled water, so that it's a 1-to-1 ratio.
Okay, and do both of those need to be in compounded form, or if I go get the liposomal, can I use that?
You know, I have been recommended by the pharmacy and other docs that do this quite often that it should be in nebulized use, should be compounded specifically for your nebulizer. I don't know if you've heard differently, Dr. Karlfeldt.
No, exactly. It's a certain form. You can't just put NAC, open up a capsule of NAC and put it in water and nebulize that. So it needs to be a
Yeah.
compounded form. Yes.
No, it's a good question, Sarah. And a lot of the reason is some of those NAC capsules will have things like silicone, you know, like silicone essentially in the capsule, you know, as a filler, the fillers, the preservatives and things like that. And you don't really want to inhale those into the lung.
Okay, so any suggestions where I could get a compounded form of each of these?
I'm going to leave that to you, Dr. Karlfeldt.
Yes, so it would actually be something that we would need to prescribe, or you would need to meet with probably Dr. Smith, and he would then prescribe that for you, and then you can use that with the nebulizer and to kind of support your lung health that way.
Okay, and Dr. Smith can do a script for a nebulizer also?
You would be able to, yes.
Awesome, thank you.
You're very welcome.
Robin has one more question about vitamin C and having ethanol in the vitamin C. I might defer to you, Dr. Karlfeldt, with that one.
With ethanol, yeah. So usually, I mean, it's okay. You know, is it a liposomal form that you have? You want to answer that? So Robin, is it a liposome? Okay.
She says yes.
Yeah. Yeah. So it's not really preferred, but it's okay. Yeah. So it's a kind of like a little preservative that they have, which is okay. So it's not, and there are different qualities out there. You got it from me. The issue is that the one that we love the most is out of stock. So then you have to go down the line as to what's next available. So it's better than nothing. Yeah, microliposome C. So it's much better than nothing, and it's okay. But my preferred brand actually is the one that I can't get a hold of. It's those little packages of liposomal C from Livon, and I'm hoping that they'll be available quite soon. But still, the microliposomal C that you're getting, it's still very good, but there are other forms that I prefer a little bit better. Yes, it's better. So she's asking, okay, I'll order more than two, and it's better to have than not to have. Right. Any other questions?
This is Lori. Do you do these IVs and so forth during the shutdown?
We are doing them currently.
You can get in there. Okay.
Yes. Yes.
You just have to call and schedule, huh? Okay.
Yes. Yes. Absolutely.
Would you recommend, what would you recommend for my husband based on what I told you about his cancer and so forth? Which one would be probably best for him?
I would actually recommend the kind of blood purifying one that I was talking about. I think that'd be really helpful for him.
It's a blood purifying, it's called? Okay. That's what you call it?
It's not the technical name, but I would say it's called PDT, or photodynamic therapy is the term for it. And so it would be the intravenous laser therapy with riboflavin, which is vitamin B2, as a photosensitizer.
Okay, and that would additionally help him build his system against the COVID too, right?
Yeah, so it works. It's been used both for cancer and also for infectious agents.
Okay, great.
When we go to the grocery store, should we be wearing gloves and masks? I mean, I have been, but what is your guys' take on that?
I think that's a personal preference. I don't myself, but I am a little bit of a rebel in some areas, and I apologize for that. So I don't mind.
Did he freeze up on you guys?
I think so, yeah. I think
okay.
Yeah, he's frozen on me too.
Yeah. Hopefully he can.
This is Haley. I have a question for Dr. Karlfeldt when he's available.
Hopefully he'll be back with us shortly. In the meantime, Sarah, I'll answer your question too.
Okay.
I am wearing gloves and mask here in California just because it is mandated that we do wear that protection. So I have been doing that, and I'm still a little bit on the school of thought though with Dr. Karlfeldt that I'm not sure how necessary that is, but because it's mandated here, I am.
Okay. Did you guys, I was late to the meeting. Did you guys talk about the antibody, is that what they're called? Antibody tests that they're doing?
We haven't talked a whole lot about that just yet. He did mention that, and I know that he is going to be getting those antibody kits at his clinic, or he may already have them there. And we actually are doing the same thing. We're expecting our antibody tests soon, and so we will be offering that for patients who do think that they may have been exposed to the virus in the past, to see if they've mounted an immune response to the virus. If it comes back positive as IgG, then they did in fact have exposure to the virus. But again, there's still a lot of uncertainty out there as to whether or not, if a person has been exposed to the virus and possibly had the virus but were asymptomatic, if they can actually acquire the virus once again. And that there's still a lot of research around that's happening right now, and they're still not sure.
Okay. Do you know how far back it goes? Because I know several people, including myself, had similar symptoms to the coronavirus, like end of January, beginning of February. Does it go back that far if we were to be tested?
Honestly, I do believe it does, because we were seeing the same thing here in California about the beginning part of January. We had a lot of people coming in with a dry cough, or what they had been diagnosed with as chronic bronchitis, high fever, and extending for long periods of time. We're talking several weeks of being very, very sick. And these are very, normally healthy people that don't get sick often. And so we saw a huge influx of these patients. And so our first thought was, well, maybe this is just a different strain of the flu virus that we haven't seen at this point. And I will say that some of the patients did have the flu vaccine. They didn't notice any increase in symptoms, but it also did not help appease the symptoms at all. In fact, they felt like it was probably even more prolonged. So I do think we had this here even at the beginning of January. Yes.
Okay, thank you.
Mm-hmm.
Yes, I have a cousin that did have the same thing. She had it in California, and she was thinking back in February, 1st of February, and he thinks she probably had it too.
Yes, yeah, I think a lot of people did. We have a lot of people in a very small space, essentially. I think here in San Diego, we have about 4.8 million people living in this area. So a small space, lots of people. So a lot of our patients were coming in with very similar symptoms, and strange for some of them too, just because of how aggressive the symptoms were.
Yeah, she's in the Sacramento area, but yeah, she was thinking now that she's probably had it.
Yeah.
I'm back.
Hey.
It just disappeared and get disconnected all of a sudden. I apologize for that. I'm glad that you were there, Dr. Black, to finish.
Yes, well, we've had a couple questions, and I'm going to try to get to everybody. I know one of the questions was about the antibody testing and whether or not you guys have the testing there at the clinic.
Yeah, so we actually are bringing the testing here to the clinic, and we're going to run a special, which means that we're looking at, unless something drastic happens, we're looking at opening, not fully, but for muscle testing here, so appointments with me in person, And in addition to IVs, as on May 1st, we're going through the logistics of it. But what we do is that for the first 100 that comes, to see me or see Dr. Smith or get an IV, we'll get the antibody testing for free. And it's a simple process. It's a little pinprick, and it takes about 10 minutes. And you find it has about 96% accuracy, and it tests them for IgG and IgM. IgM will be then your active, and IgG will be if you've been exposed in the past.
Is that the
Thank you.
same test they're doing on Crush the Curve?
It is different, yeah. So they are using their test. I believe it's actually a PCR test. It has a higher specificity. So, but it doesn't. I don't think that it tests for the I think it's a little bit different than what they do. Yeah, so they're actually doing a blood draw and they're sending it into a lab or I believe it's a university in Seattle or something like that, and testing it that way. So I would probably say that one is a little bit higher specificity, but this way you can it becomes kind of a private. You can find out on your own whether you have it. It's very simple. You find out in 10 minutes. And it's a 96%. It's pretty high accuracy, but obviously it's not 100%.
Okay.
I know Robin had a quick question about using too much hand sanitizer causing swelling in the lymph nodes and neck. Have you seen that at all, Dr. Karlfeldt?
I have actually. There's been a number of patients because of the increased use of these sanitizers, because there's a number of them contain toxic substances, and if you use a high quantity of it, you're going to absorb that through the skin, and then the body has to process that, so it has to go through then the lymph nodes, and your liver has to process it, kidneys has to process it, so you can then create in your neck, you have a lot of lymph nodes around here, so they can swell up as they're trying to filter out some of these chemicals from the sanitizers.
And then there was another question about to Jen. Jen was asking about her infrared mat and wondering if that would be beneficial.
Yeah, so infrared tends to actually stimulate the immune system, which is great. So that way you're supporting the immune system's ability to fight off these pathogens. So I would definitely, you have different versions of it. Here at the office, we have something that's called Biomat, which has been really good. It has infrared with ions, because of some amethyst crystals that are there. And they've actually used different types of infrared mats to fight off things even as severe as cancer in Japan, because it has such a good stimulating effect on the immune system. Did that answer your question, Jen? Sarah, okay, good, thank you. Sarah, did you have something you want to say?
Yes. So I don't know if you guys have covered this. Sorry. Do you guys suggest when they come out with a vaccine to get that vaccine or no?
It is. I'm not. I should say that it needs to be a personal choice. I cannot tell you what medical care that you should or should not get. Because that would be outside my scope. I know for myself. I'd be very leery to get a vaccine that has not gone through testing and that has a history of severe reactions. And so I myself would be very leery and would do everything I can not to get it.
Okay. I agree with you. I just wanted to see what your thought was.
Yeah. So I don't know. Were you here when I was talking about the vaccine a little bit earlier?
No, I wasn't. I saw that you sent out an email about natural vaccine, or was it a video? I haven't looked at that yet.
Yeah, so and if you go back to the recording, we're going to post this recording later on our website.
Okay.
So you can listen to some of my comments there. And also I would highly encourage you to listen to the interview that's going to air at 5 o'clock on Sunday with Dr. Leon Weiler.
Okay, and is it going to be on this same app?
It will be on the radio, so it's 580 AM or 107.5 FM.
580 AM. What was the FM?
107.5.
Okay, thank you.
So Robin is asking anything we can do to help lymph system while staying sanitizing. I've been upping vitamin C dose. So in regards to the lymph system, it's good to do, you have a classification of supplements or herbs that are called blood purifiers. And what is included in that group are things like burdock, sarsaparilla, red clover, yellow dock. These are really good at cleaning out the lymphatic system. Echinacea is another one that's really good. So I would definitely make sure that you do a lot of that in addition to loading on things like vitamin C and glutathione. And if you can get IVs as well where you're at, Robin, I would highly recommend that as well.
Another thing, Robin, that you can do, I don't know if you've tried dry skin brushing, which is basically just brushing the skin with a dry brush to help increase circulations through the lymphatic system. You can also do the hot and cold contrast showers or even warming socks, or wet socks is what we call them, which is basically where you can take a pair of cotton socks and put them under water and wring them out and I put them in the freezer for about 5 minutes so they get really cold. And then you'll warm your feet, and then you'll place these cotton socks over your warm feet, and then on top of the cotton sock you can put a wool sock over top of that, and then go to sleep with that actually. And in the morning the dry sock or the cotton sock should be dry, so that also helps increase the immune system as well as lymphatics. And those are just some things that you can do at home.
Excellent. Any other questions?
Can you talk a little bit about how the coronavirus mutates and if that's a concern, if that changes the impact of the virus and how you should treat the virus as it mutates?
So I'm hearing a little bit different things about that. I mean, the interview, I was talking to the epidemiologist, Dr. Knut Witkowski, and I was posing that question, and he felt that the mutation was not a big concern, meaning that if you support, what should I say, we're talking specific about the vaccine, in regard to then if we have a vaccine against it and the virus mutates, what are we, how do we know that the vaccine is specifically for the virus that we're being exposed to at that time, because it's probably mutated quite a bit. He didn't seem to be that concerned about it, but I'm talking then to an epidemiologist, so then you have to recognize who is expert in what. Talking to Dr. Judy Mikovits, she seemed more that there is mutations that are taking place, just like with the flu virus or that we're dealing with every year. And because of its mutations, because it's changing every year, then we have to continually update the type of vaccine that we're using. So then obviously, how are we going to shoot something that keeps moving if we're just putting the gun, so to say, in just one direction, and then we're just shooting there? And if it's a moving target, then the likelihood we're going to hit it's very minimal. So I wish I could give you a definitive answer, but I'm just trying to rely on experts that are smarter than me. And So the conclusion that I have in regards to that is that the best system we have to recognize the mutations and recognize what kind of virus that we're dealing with is still our immune system. So I would still go back to supporting the immune system and doing therapies to keep the viral load low. Yeah, that's my 2 cents.
Is that why you think some of the symptoms vary so much from either mild to extreme, is how good the person's immune system was when they contracted it?
I think that is one factor, absolutely. I also think that we're talking about the comorbidity and components. So if you, so we're dealing with the immune system, but we're also dealing with how much inflammatory processes are you dealing with? How many reactive oxygen species or kind of oxidative substances does an individual have? So if they have, so in your body you have what's called a kind of antioxidant, and then you have something that oxidizes, and you need, so it's kind of that redox, reduction and oxidative. The reduction is that when you're reducing the oxidative stress, and that's where you use the antioxidant. So if a person is out of balance there, meaning that they have a lot of oxidative substances, a lot of the reactive oxygen species, it means that it's kind of like there's a lot of fire there. I mean, you need the fire to get rid of pathogens, but if the fire is turned up too high, then you get into that strong inflammatory state where you have that cytokine storm. So you need to then kind of keep reducing the levels of oxidative stress in your body. And you do that then with antioxidants like vitamin C, vitamin A, vitamin D, vitamin E, all these different antioxidants that exist naturally in fruits and vegetables. So if you continually support your body that way, the oxidative stress in your system is lower, and you should be able to handle then the immune system's reaction better when you're exposed to the virus. So I think that is a big factor in addition to then the immune system, because if you're dealing with something like cardiovascular concerns, asthma, or diabetes, which are some of the kind of comorbidity that we're seeing, all of those are inflammatory conditions, which means that your level of your antioxidant bank is very low. So I think that plays a huge role into it. Do you have any other thoughts about that, Dr. Black?
Everything that you just said, I absolutely would agree with. I think I do think that the cases that we've seen more often than not, it's the comorbidity issue rather than just a weakened immune system. Most of those patients do have some sort of condition, underlying health condition.
Right, thank you.
You're welcome, Sarah. Any other questions? I think you guys have really posed a lot of great questions. I know we've been going for a little bit more than an hour. So let's do 2 more questions if you have. Looks like you guys are questioned out. Let me see here. What about infrared light bulbs? Janet is asking. So even what they've seen, even LED or it still has an impact, or infrared light bulbs, it still has an impact, a beneficial impact. So I would, it may not be as great as some of the other more expensive tools, but it still has an impact. I was talking to Dr. Michael Hamblin. He's one of the leaders in the world in regards to research on how light is impacting us, and he said that even some of these cheap infrared things can really benefit us.
Where do you get those?
Yeah, I mean, you have even kind of like a security. I would listen. Go to the interview I did with Dr. Michael Hamblin, and you can go. It's on my YouTube channel or on my website. You can just type in Hamblin, Hamblin, and I know you can probably just search it on Amazon. Yeah, infrared light bulbs, and even as I said, even if it's just cheap quality, it still seems to have an impact. You know, still to have a very good impact.
And what does it exactly do?
So they really help to reduce inflammation, and it also help to stimulate the immune system. So those are very good things. So even what they've seen with people with brain disorders, like even Parkinson's, have these little helmets with, you know, where you can do with infrared light bulbs. And even though it may not be that strong, it may not penetrate that deep, it still seemed to have an impact. So I mean, we have better tools here at the center, you know, where we have stronger, you know, we have one of these Weber laser helmets, you know, with infrared that penetrates deeper. But if you don't have access to that, then even just regular, you know, infrared would help, you know, just regular light bulbs.
Okay.
Actually, Rachel in the notes here, she gave you the link to Dr. Hamblin, so you can look in the notes there.
Okay, great. Thank you.
And I know Stephen and Candice, both or either one of you, asked about, does this include sunlight in regards to infrared and you know, being anti-inflammatory? And what's that? Yeah. So yes, sunlight does stimulate the immune system, and it is very anti-inflammatory. So, you know, being out in the sun is a perfect thing to do. And this is the reason why flu season tends to end when sun comes out.
Do you guys think this virus will be better then in the summertime? It'll go down because of the weather?
Yes,
Awesome.
I do.
Yes, I agree with that as well, Sarah.
Great, thank you.
You're welcome. Great. Well, any other questions before we wrap up? Great.
How long do you think this will take to blow over with the stay-at-home orders still being in place?
Well, I think it will take as long as the politicians want it to take. And I don't. Yeah. Yeah. I think it's more kind of a political. I think there's a lot of political components behind it. Yeah. Then and I think that's sad that is, but that's what I suspect.
I agree. Thank you.
You're very welcome. Well, thank you guys for coming. This is recorded, so it will be posted on my website probably come Monday, and also in the email that we sent out, it will be there as well. So if there are certain components that you felt that, you know, I missed this and I want to kind of hear what they really said, then you have the ability to go back and listen to it. And also, if you feel that information here is useful, yeah, please share. I mean, I feel the more people that are empowered with information, the less fear we have, and that's all I'm trying to do. I'm not saying that I'm right with everything, and I don't think that there's anyone that really 100% know. But I try to educate myself, and I try to listen to people that are smarter, and then say what they're saying. So thank you guys for coming, and please share if you have any, if you feel that this is useful. And Dr. Black, thank you so much for being with us today.
Thank you for having me. Thank you all for having me this evening.
Thank you.
Thank you. Well, you have a wonderful rest of the evening, everyone.
Thank
You guys
you.
too. Thank you.
Thanks so much.
Bye now.
Bye-bye.
Thanks. Bye.